Hi, my name is Abigail Dodona, and today I'm going to be talking about the opioid crisis and the effects of the availability of naloxone. My research mainly focused on how the increase of Narcan availability is critical in saving lives. So to give you a breakdown of what I'm going to be talking about, first I'm going to talk about what are opioids and what is the opioid crisis. Then I will give you a brief history about Narcan and the background of the availability and how it came about. And my research focused on two main components, which were effectiveness and efficiency. Lastly, I'll summarize my findings. Before I talk about what the opioid crisis is, I wanted to run you through some common opioids. First, we have heroin. Heroin, as many of you know, is illegal and is used recreationally. Next, we have codeine. Codeine is prescribed to treat pain. And lastly, we have fentanyl. Fentanyl can be prescribed under strict conditions, but most of the time fentanyl is made illegally and used recreationally. So how did the opioid crisis kind of come about? In the 1990s, pharmaceutical companies reassured the medical field that patients would not become addicted to opioid drugs. Since many of the prescriptions controlled extreme pain, physicians began prescribing opioids more frequently. Opioid prescriptions quadrupled, so did the deaths. As you can see, the graph indicates the climb of opioid sales and the overdose deaths. They almost increased at the same rate. So the Department of Health and Human Services has 5 main priorities for the opioid overdose crisis. First, improve access to recovery programs. Then, promote the use of opioid reversal drugs such as Narcan. Understand better health surveillance. Provide support for research on pain. And lastly, advance practices for pain management. Many policymakers are trying to control the opioid overdose crisis, and so far the only thing that has stopped the overdoses and the deaths that come along with it is the access to Narcan. So what is naloxone? Naloxone is more commonly known as Narcan. I'm going to be referring to naloxone as Narcan for most of this presentation. But Narcan is an antidote, which is a medicine that is taken to counteract a particular poison. The purpose of Narcan is simply when someone overdoses, their breathing and their heart rate begin to slow. That's when Narcan should be administered to stop the opioid from reaching the brain. For example, the nasal spray takes 2 to 5 minutes, but the effects only last for about a half hour to an hour, so that's when someone would need to seek further medical treatment. And lastly, there's different forms. Like I said, there's the nasal spray as well as an injection. So to give you a little bit of background on naloxone, in 1961, naloxone was actually patented by Lowenstein and Fishman under a company called Sankyo. After 10 years, the patent expired and the Food and Drug Administration approved Narcan as an opioid reversal drug. First responders, such as police officers, firefighters, and paramedics, were the only ones to have access to Narcan at the time. Many states began expanding the access due to the immense amount of deaths that were occurring from overdoses. In Pennsylvania, Governor Tom Wolf expanded access to laypersons, which is like a third party. Act 139, also known as David's Law, was the law that allowed prescriptions of Narcan to family members or friends. The Good Samaritan Law was also put in place to protect a third party if they called 911, even if they were participating in drugs, and also if Narcan was administered incorrectly. So if a third person administered Narcan incorrectly, this law would not hold them liable for the death of that person. So is increasing availability effective? There are 2 important aspects to look at when it comes to effectiveness. you have substance abuse, and you have saving lives. In terms of substance abuse, Narcan does not increase nor does it decrease substance abuse. Many people have said that they feel as though they have a second chance at life and that they're going to seek the help that they've needed. But as a population, it hasn't increased nor has it decreased. So Narcan isn't effective in terms of getting people to stop using opioids. In terms of saving lives, Narcan is extremely effective. Most states have seen 9 to 11% decrease of opioid overdoses, which is a significant number, and that's definitely enough to affect a population. And from 1996 to 2004, over 27,000 lives were saved by a layperson. So that just shows that increasing availability without having the availability going to a layperson, those 27 lives probably would not have been saved. So, is increasing availability efficient? Many insurance companies cover Narcan, including Medicare and Medicaid. Depending on the type of naloxone you receive, the prices may vary, and there are different brands. Narcan is included. First, there's generic naloxone, which is around $20 to $40. There is an Evzio 2-injector kit, which is around $4,000, but these kits come with step-by-step instructions. Then Narcan nasal spray costs around $140. The costs aren't crazy amount in order to save a life. So when you start talking about budgeting, in Pennsylvania, the state budget in 2017 and 2018 was $5 million for Narcan. Then the Substance Abuse and Mental Health Administration stated that there was $1.82 billion from federal funds available for Narcan distribution. When you take in costs and the budgets and the amount of money we have, I think Narcan is fairly efficient. Overall, expansion of Narcan doesn't discourage nor encourage substance abuse. After receiving Narcan after an overdose, many feel as though it is their second chance at life. As a whole, the population is not affected due to expansion. Narcan availability is, however, very effective in terms of saving lives. As more people carry Narcan, more lives are being saved. Also, with insurance companies and the state and federal budgets, I believe that Narcan is efficient, but it only costs around $20 to save a life. Narcan is an important tool for people who are addicted to opioids and also for the public.